అంటే నా పక్కన ఇది వైర్లెస్
performance energy సో ఇది చాలా ఇంపార్టెంట్. ఇది మీరు తెలుసుకుంటే అందరికీ బాగా వస్తుంది. కాబట్టి మీరు నగరాల విషయం కాదు, కామెంట్ చేయాల్సిన విషయం కాదు, ఇది ఒక ఆపర్చునిటీ తీసుకోవాలి. మీకు ఒక మంచి ఆపర్చునిటీ మనం చూస్తే ఇక్కడ జనరల్ పేషెంట్స్ ఉంటారు, గైనకాలజిస్ట్ ఉంటారు, న్యూరాలజిస్ట్ ఉంటారు, కానీ ఈ ఓన్లీ 5 ఆయన కన్సల్టేషన్ తీసుకోవాలంటే ఒక కన్సల్టేషన్ సో మంచి ఆపర్చునిటీ తీసుకోవాలి. వాడు ఏం చెప్తాడో వినండి. కాకపోతే ఇంప్లిమెంట్ పరీక్షలో మీరు అందరికీ తల్లిదండ్రులు ఎంత కష్టపడతారు, అందరికీ మంచి పేరు వస్తారు. సో ఓకేనా, ఎంతో చాలా రూట్ కాస్ నుంచి మీకు అర్థమవుతుంది. Anemia is a crucial problem that we must address collectively. What we are doing? Did you know that more than 50% of adults and girls in India are anemic? This affects not just their health, but also their energy, focus, education, and future motherhood. The good news is anemia is preventable, reversible, with the right habits, awareness, and empowerment. Our work so far, we conducted 10 plus awareness camps in colleges and communities, which hundreds of girls physically care about identical in many camps, even spent examples to identify those of this. We are proud to say that these initiatives are currently funded by the foundation, driven by partners and the belief to create just name. Our vision going forward, but we also know awareness about this concept. We want to move from information to transformation, from simply conducting can for creating measurable impact. So what the seconds to habit formation, health back to organizing, believe real change happens when the community prospects, the youth live, ethical standards, small acts can prevent this. We want every adolescent girl we wish to adopt these one small change. Taking identity regularly, understanding traditional testing, getting tested, my own class. Today, I was very fortunate to become an ambassador for India prevention. And finally, Dr. Kumar of the wonderful report. Let's not stop at awareness. Let's build a movement where no there is a bad by something. So anybody need to let us? About 10%. Of you are not married. Okay, I don't take much time, don't worry. The studying most important points and and I'll keep it more like an interaction. So if you can ask your questions and then I'll answer you. So what are we talking about? What is the topic today? Anemia. So what is anemia? Sir? Okay, two parts. So it's nothing but low hemoglobin. What does it mean? So if you have low hemoglobin, you have low energy. If you're active, moving around, going to school, studying hard, able to study hard, not able to do your day-to-day activities with energy, then it means you have normal hemoglobin. The quite opposite of it, you are feeling the sick, unable to concentrate on your studies, gets excessive breathlessness when you just try to stay, so start playing, unable to get sleep. Then these are signs of fatigue. It's not like if you don't feel like reading, you have to read. This is also not the reason. But I would like to define it in the easy way where you can remember. So when you feel like you are not reading books, when you feel like living and you want to sleep more, and if you feel like don't go to school and don't play with other kids, always remember you might be having anemia, which is low hemoglobin. So basically, hemoglobin is something which carries oxygen. So we breathe, right? So how does the oxygen from the environment go into hemoglobin and gets used as an energy producing? So hemoglobin is the main carries oxygen from the environment and carries to each cell inside your body. Okay? That's how you have energy and that's how you do your day-to-day activities. Okay, so now what are the reasons for low hemoglobin? So we should have had some testing now, but that didn't happen. Last time when we had the civilization here, we could test the 50 girls in the class. So how many of them would have had anemia? Yes, it's right. Say 50 girls have screened for low hemoglobin. How many of them would have had anemia? Low hemoglobin. So first it depends normal range. Normal range is something between 12 grams to 15 grams. You know what? Okay. So how many of you will have 10 grams or less than 10 grams? So we divide this over columns. So last thing, first thing among you. So how many of you would think would have had low hemoglobin among 50 girls? How many girls would have had less than 10? Approx 20? So you see almost 50% of anemia from this side. How many of them would have had low hemoglobin? So imagine 50% of India women being anemic, low hemoglobin. Do you think it's real? Or it's a fake statistics? This is roughly a small sample which were tested here, which showed that 50% of girls are anemic. If you calculate whole data in India, the studies what we have also say that 50% of Indian women are anemic. So it's a huge number. Why there is so big problem? We should not look at the problem at a face value. What we should do? We should always look at the root cause of that. Where did it start? If you can identify that, I'll assure you, you will solve 90% of your problems in your whole life. Leave the health part. If you have your personal life, in your academic life, wherever. Always try to pinpoint the root cause of the disease. So, what is the root cause of anemia? So, normally, you have had, 40 this conversation might be happening in your home. So, parents will also be telling you, eat this, eat that, why you're not eating, you don't eat at the time. Okay, eat a little bit extra rice, a little bit extra curry. Okay. How many of you didn't have this? How many of you didn't have this conversation in your home? So less than 5%. So which means that whenever we have low hemoglobin, when we feel low, the normal thing in any home or anywhere is to suggest to improvise on diet. To eat more fruits, to eat more food, healthy diet. Whenever you do. So, what are the most common reasons for we relax nutrients which make it better? So, when anyone has what are the main nutrients? So, iron, B12. Iron and B12 are the two most important ingredients which make bread. There are many small micronutrients which are essential. But B12 and iron are like pillars of this college. There are no pillars. We can't build this college. Similarly, if you don't have iron and B12, you can't make bread. If you have 12 grams and without iron, hemoglobin can drop to even 1 gram. I have a patient who came in 2025. We met with him now, she's living with programs. So normally it's program, it's 2 grams. Even that is possible if you lack iron people. So 90% of the time it's lack of iron. There are other reasons also which I have not discussed much. Our part of discussion is mainly nutrition. What are the other reasons, like say, there are different blood disorders where diet is not involved? Means to say, eat however fruits you want. Eat food equal to 10 people. Sit down and tell, eat food, eat almost like equal to 5%. The problem cannot be solved, right? Because every case of anemia is not linked to iron and vitamin. Suppose there are 10 patients with low hemoglobin. Assume that 7 patients will have low iron and B12, that's why there is low hemoglobin. They need diet improvement and nutrition improvement. Among 3 patients, they have something different, which will not correct with your diet, with iron supplements, with B12 supplements, with fruits, with beetroot juice, carrot juice, or wheatgrass juice, or dragon fruit like stage fruit, or dragon fruit. So it won't get solved with dietary changes. Okay? So among those, there are few So now we focus on the problem where 80% suffer from, which is dietary. So as I told you, iron B12 most important, right? Suppose you have low hemoglobin. What are the food or fruits or dietary elements we should eat for? We start with first 2 rows. Suppose say you have hemoglobin of 10 grams, 8 grams to each other. Second row. First row. Which food should we eat? We have low. Name one top food. You can say whatever. Fruits. Can anybody specify which fruit you should eat? Because it's very red and juicy. So you think it has. Normally the fancy, however, the extent of redness in the fruit decides okay. So it's not red. The fruit is red, doesn't mean it carries red in it. And you drink it and your blood will shoot. Okay. It's more because of some pigments, the fruit is red. So if you take, so this girl says, they are saying that if you daily drink 1 glass of pomegranate juice, okay, my HP of 10 grams will shoot to 12 grams in 1 month. Okay, or say 2 weeks. So anybody else? Any other? Papaya. Okay. So those that group over there wants to drink papaya juice every day for next 1 month. So you don't. Just anybody else here? Papaya, beetroot is more, much more reddish color than. But only problem is it doesn't taste as good as pomegranate. It's the only problem. Okay, so glass of beetroot juice for 1 month. Then in that room, last one. Apple, okay. So these are the classification of fruits which increase blood dramatically. So one is pomegranate, beetroot, papaya, apple. So okay now, so next I'll go to vegetables, then I'll come back. So name one vegetable. Tomato. Okay. I'll come back. Wait. I'll come back. The first one here says tomato, right? Because it's red. There's no group over there. Okay, so green. They are very green. Okay. So green leafy vegetables. So what will you do? You make a juice of. So you want it to boil and then. The group over there. Huh? So carrot juice. So they want to bring carrot. And over here. The same, right? Leafy vegetables, spinach is included. So name some other vegetable that you think by having them regularly you can boost your health. Huh? Get a board. Telugu? American. Let's clear. I forgot it English in online. Okay. So now we come back to the topic. Okay, hold on. I put up last time, but very fast. So the first group, we spoke about fruits, right? So pomegranate versus papaya versus apple versus beetroot. So if you take 100 grams of each fruit and then you calculate how much iron it has in each, then you know, right? So I don't want to speak right, okay? We will go for scientific because we need evidence for anything. We don't believe anything blindly. Look for evidence. Like say in your life you do anything, most of the things what you will calculate, right? Walking on a road, if I walk by footpath, then I will say, if I walk randomly in between road, I'll get hit by something. There will be some calculation. You go by reasoning, logic, past experiences, then you will decide, right? Most of it. So if you are doing this, everybody is safe. So you apply same thing in your food because you are depending on a fruit or to increase your hemoglobin. You don't want to do it blindly. You need some evidence that it will raise your hemoglobin. So again coming back to root cause. So why your hemoglobin went down? It's because of low iron. Now I would like to increase my iron levels by taking one of these juices. Now we calculate 100 grams plus value of B2. Beetroot. Beetroot. The first two beetroot, so 100 grams of beetroot, it has approximately less than 1 milligram of iron. And these are rough estimate, don't underline my sentences and go check internet and say doctor is saying wrong. These are approximate estimates. Okay? So going back to pomegranate, papaya. So papaya, pomegranate, beetroot and apple, you take any fruit, it will have less than 1 milligram of iron, approximately. If you have anemia, how much iron do you need in a day? I answer this question, okay? So if you have anemia, say hemoglobin of 7 grams, in a day, you will need approximately 30 milligrams to 50 milligrams of iron. How much? 30 milligram to 50 milligram iron. So now this less than 1 milligram iron in this 100 grams. So how many glasses you have to take? If you want 30 milligram in a day, suppose say 30 glasses, no, approximately. So if you assume 1 milligram, 30 glasses of beetroot, imagine in a day, to increase your hemoglobin from 7 to 9. Is it possible? Even if not possible, those who see apple is tasty, pomegranate is tasty. Can you drink 30 glasses of pomegranate, 30 glasses of apple? Even if can't. So this is science. Suppose say you have hemoglobin of 12 grams. If you want to maintain your hemoglobin, if you want to remain healthy, you can happily take one of these on a regular basis to keep yourself healthy, maintain normal hemoglobin. So if you don't have anemia, if you want to maintain normal iron stores in your body, having fruits, having beetroot, having apple, having what other food. So taking these will definitely help you to keep remain healthy. But not when your HB becomes less than 10. It's not like you shouldn't eat fruits. I'm talking about specifically depending on only this fruit juice to raise your hemoglobin may not help you. In fact, by the time you are waiting for HB can crash one. Because the calculation says if you drink 30 glasses, then you may. It's possible. But humanly not possible to drink so many glasses in a day, right? Similarly, if you take vegetables, okay, similar calculation comes. Most of them, you cannot eat 1 kg leafy vegetables. See, normally in a day-to-day, daily food, sambar or dal, how many leaves of leafy vegetables?
Hardly they will be scattered here and there. They won't weigh even 50 grams if I'm not wrong. So these are all healthy diet which helps you to maintain your day-to-day hemoglobin and your nucleus. So now we will change the food. So how many eat meat here? Almost 70%. Okay, 70%. So now I'll go back to the top and now I'll make it much simpler. See, now we'll classify food items into vegetarian food and non-vegetarian food. And now we'll talk taking how much of what will increase your hemoglobin. So remember, even non-vegetarian food or vegetarian food, if you have very low hemoglobin, don't depend only on diet. There's a point. Even if you calculate values from non-vegetarian also, it's almost the same message. Diet is an additional element which helps you to maintain it. You don't depend on it exclusively when you have. I'm talking about cases when the HB is too low. Okay. So now, generally speaking, if you take foods rich in iron, in vegetarian foods, as I told you, green leafy vegetables have very high iron levels when compared to other foods. If you are a vegetarian, if you don't eat meat, remember eating green leafy vegetables daily, adding ragi, or eating dry fruits such like anjeer, okay, and adding lemon to your diet regularly, definitely help you maintain your hemoglobin if you are a vegetarian. If you are a non-vegetarian, then no problem at all. So why? Because meat has the highest observable iron in any food compared to other foods. Okay? So meat eaters generally they eat meat regularly once or twice a week. So they will get enough iron. But eating only meat is not healthy. You should always add veggies, which is a very healthy diet, and balance the diet accordingly. So there are two differences are there. The vegetarians, whatever iron you are going to take from the food, only 10% is absorbed also. 10 to 20% is absorbed. Whereas in meat, the absorption percentage is much higher. This is the more reason when you are a vegetarian, you should be very conscious. You should focus on green leafy vegetables, legumes, various grains, okay, and little bit on dry fruits and also fruits. Don't make your diet complex. If you are eating green veggies regularly, okay, that should be enough for vegetarians. Anyway, non-vegetarians, they will not eat only meat daily, so they will have green veggies. They have additional benefit of iron absorption from meat. Okay. So how much iron does milk has? Milk will have very negligible iron. So don't depend on it. Milk, fruits, veggies are for nutrients, not for building blocks of blood, which is iron and protein. Okay, this is the most important. So now I take questions from you. So, if anybody has questions, they can ask. And B12 normally is found only in animal foods, okay, remember, reported. The second building block of blood. So what do you mean by only animal products? If you have B12 deficiency, again you can have same problem. B12 but is found only in animal foods. Okay. So what are animal foods? Not compulsory meat products. Milk, yeah, excellent. So milk products, if you are taking regularly milk and milk products, then don't worry, you will have enough B12. Recently I had a patient, who brought wheatgrass powder packet. It was packet with wheatgrass. He brought it to me and he sat with me and the doctor is asking, doctor, is this useful if I take that? And you know what I did? I took one iron tablet and I took the wheatgrass packet and I compared the ingredients. It was written iron per serving 0.1 milligram in the papers. Okay. The packet of wheat grass has a cost of 600 rupees. Nearly. A single tablet of iron has a 30 to 50 milligram of iron. If you compare the cost value of wheatgrass and iron tablet, now the one tablet which costs nearly 5 rupees to 6 rupees approximately, it can be lesser than that. And the wheatgrass, almost 100 times costlier than tablet. So you always go a scientific way to ask questions, and is this food really helping or not? Definitely natural foods, natural elements will help you to stay healthy. When you have to maintain your hemoglobin in normal levels, but not to boost your hemoglobin. Okay? Any doubts?
Giving blood alone is not enough. Listen to what he is saying now.
So are we doing testing there? Do you have reports? Early reports? So she's asking, why do we eat more slate pencils? So that we have to very, you feel like this is really nice. And then you would feel like smelling paint and smell of mud. Petrol and nail polish. Okay. Eating raw rice. The question is, why do you feel like eating raw rice? It's an excellent question. This is called Pica. There is a special word for this abnormal sensation to eat or smell inedible items. Okay? It's an abnormal feeling to smell or eat inedible. Inedible means those who are not normal, you don't eat protein. This happens because of your low iron levels. So many people, parents complain, doctor, my daughter is eating raw rice every time. I told her, many times, never listens to me. And she also eats these chuck pieces and but my answer would be no, it's not. I have a low hemoglobin is not because she is eating raw rice, not because she is eating the chuck pieces. Because of low iron, she feels like eating those things. It's not their mistake. No, some people will feel very guilty. Why am I eating this? I'm very much urged to eat these. It's not your mistake. It's some problem happening inside your body because of low iron levels. So what is the answer or what is the solution here? Again, root cause. Iron levels low, then you correct your iron. If you build your iron levels well, then all those abnormal feelings will leave. Then you become normal. You will stop eating raw rice. If you like it and if you want to continue doing it and if you don't want to take iron, then you have other problem. You have to stop your education. Whatever, there are class board by the top. Test. Some unit test is going. Okay, good. Oh, blood test, okay. They are going for the blood sample. So we have reports, early reports. Just check with them how many of them got tested. Do you have any values so far? Even 10 to 15 is fine. But I'm not asking individual reports. At least so far, list of people who got screened and they Quick. Get the file first. So I'll give it back. Let them get the file. I'll immediately give it. 2 minutes. So next thing, see one more thing. See if you have low platelets, see whenever you search YouTube is very well known for education videos. Just type the query how to increase blood. We get many videos. I also have a YouTube channel. They search my name and Google it. So if you search video, you will find some people talking about low platelets and they advising to drink carrot juice, papaya juice, beetroot juice, pomegranate. What should you ask? What question should come next? What is the reason for low immunity? If it is iron deficiency and mineral deficiency, are they linked to low platelets or not? I told hemoglobin is 100% linked to iron and because platelets are not linked. Platelets are only linked to people. They are not linked with iron. So taking beetroot juice, carrot juice, whatever papaya juice, assuming you will increase your platelet count, you are going to waste your time. Okay? So again, see, always remember, whoever speaks, you should ask what is their qualification. Somebody speaking nicely to you and making you entertain, he will not be qualified. What is my qualification? I am a hematologist. I deal with blood disorders. I treat exclusive blood disorders, including blood cancers. Okay? My focus subject is exclusive blood since 15 years. Okay. So similarly, when somebody speaks about increasing blood and you use diet, you should ask qualification. Speaking well is not a qualification. Speaking in an entertaining way is not a qualification. Having grey hair, okay, and having an age of 65 years is not qualification. What is the expertise? The person who is speaking in this subject, what is talking. This is the most important question you should ask. These are very important questions in your academic, personal, and wherever you always ask tough questions. Okay, very important. So most of them will speak, they not know difference between hemoglobin, platelets, red blood cells. They start with saying increase your hemoglobin with papaya juice and the second, within few seconds they will say platelet loss increase. Okay? Platelets are different, hemoglobin are different, white cell count are different. Three are different. Three are affected in different ways. Okay, I got the report. So we'll go through it. So we have 25. So 25 girls have been tested. Why not read names? Okay. Let's say the values for one. So you can see among 25 more than 11 grams. So how many of them have more than 11 grams? If I count 1, 2, 3, 4, 5. So among 25 girls, only 5 have HB more than 11, not even 12. None have 12 anymore. Which is ideal. You need to have to start with 12 grams. But if I take 12 cut off, then none of them have 12. 11 at least is okay. One girl has 11.9, almost 12. Other than third girl, I think remaining all approximately 11. 5 girls with 11 hemoglobin. And if I calculate less than 10 is important for us. So say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 16. Oh, 16 is becoming like 90% one people. I got 50%. So 16 girls are SB of 10 and less than. Now you understand the problem. The real world problem, apart from theory. And less than 5. World level has 5.3. No. I think the class teacher who should have required the less than 7, between 5 to 7. That's also kind of borderline range, the risky range. 5 to 7, if you calculate, we have 5 to 8. Okay, 5 to 8 will calculate. 5 to 8 again, including this 5 point figure. 1, 2, 3, 4, 5, 6. 6 girls are between 5 to 8. Again, this is borderline. These kids also should be identified and informed. So it's a much bigger problem than we imagine. See what will happen. Your progress report, marks which you get, the concentration class, okay, the relation with your friends, your parents. So do you think can be decided by a reform of it? So all these variables, effects which you have on your personal life, need not be because you are lazy, need not be because you don't have interest in studies, need not be your personality problem. It can be just because you have no hemoglobin. Not that because you are lazy or no hemoglobin. If you have a normal hemoglobin, if you are not like to study, then there's a different thing which you should address. Okay. So I don't have time. If any doubts I take, otherwise I will close the session. Anybody wants to volunteer? So how can you achieve greatest success in your life? Name one quality which will help you to reach peaks of your career or success in any field you chose. Huh? Sorry? Discipline. Asking questions. We should question everything. Why this is happening? Why we shouldn't be? Why it can't be like this? Why we should follow only this protocol? This is my thought. May not be right in every case, but what I believe is, if you acquire a habit of questioning everything, then you will have a uniqueness which cannot be competed. Then you will have your own, you can develop your own field and your career path. There you have very less competition. Okay? Okay, any doubts I'll take, otherwise I'll close. Yeah, I have one doubt.
Sir, what are the fruits we can have on a regular basis, sir?
Oh, yes, a very good question. So what are the fruits we should regularly have to maintain your hemoglobin? See, fruits are not a great nutrients, to maintain your hemoglobin. It's why they are expensive. No need to depend on fruits. Having green leaf vegetables regularly in your diet is more than enough to maintain your hemoglobin. Okay? If you want to eat fruits, okay, generally take any fruit, it will have more of carbohydrates, mineral, water content, nutrients, micronutrients, and also iron. Iron is one of the components in many foods, but not the dominating component. But except in dry fruits, anjeer, especially this fruit, there is especially higher concentration of iron. And relatively dry fruits have some little bit more iron. Otherwise, if you include adequate leafy vegetables in your diet, specifically speaking, adding 1 or 2 anjir possible will keep you healthy. Fruits are an additional element to nourish your health, to add micronutrients, vitamin A, other vitamins, and for general health purpose, fruits. Got your?
Yes, sir. Something else, sir?
One more question?
Yes, sir.
Yeah.
What is the meat we can intake, sir? Like
What is
specific meat. Meat.
Meat.
Yes.
Meat has the highest iron content. So it doesn't matter which meat you like. Any meat has a similar iron content. You know, the per gram, per 100 grams, almost similar in any meat. But you will always prefer lean meat and fish when compared to red meat. Priority wise and health preferences wise, because red meat has a special problem. So otherwise meat, I think it is okay.
Yes, sir. Something else, sir?
One more, yeah.
Yes, sir.
Last.
What do we have to intake to increase our blood percentage, sir?
So again,
For increase in the blood percentage, what do we need to consume?
to increase blood percentage. This is my talk. I told everything I was asking this again. Okay, anyway, this will help me to conclude the talk also. This is the last one. So to increase your blood, first answer, what is the reason for your low hemoglobin? Okay, what is the reason for low hemoglobin? Not every anemia is. My voice is gone. So not every anemia is related to food. If it is related to food, it will iron, then no. If you have iron deficiency, focus on diet which increases your iron. Say green leafy vegetables, legumes, grapes, dry fruits, few certain dry fruits, okay? And meat. If it is B12 deficiency, if you are a vegetarian, compulsorily include dairy products, milk and milk products in your diet. If you are a non-vegetarian, then fine. There are some disorders where even diet cannot correct. That's a different story. I will make too much for it. So basically, keep it simple. Don't prepare complex diets. Don't rely on exclusive fruit juices
Hello?
and juices of vegetables,
Huh?
which may not help you. Identify root cause and treat with the, whatever method which is scientifically proven and has evidence. Okay, this is most important. Okay, we close here. So I have to leave. So thank you all for your patience. So thank you for appreciation, and also I should thank you for your time. And so for special thanks to Stella ma'am, principal, for allowing us here to share this information with you and benefiting all of us in the process. Okay, thank you.
We are very grateful to have you here today, sir. Thank you for your precious time. Other than our precious time, your time is also very precious. And thank you for answering all my doubts and sorry for the last question. And also, sir, I need to mention a special thank you for also Yuvraj sir and Karuna Kumar sir. Thank you for taking time for us and being present. We really appreciate it a lot, sir. Thank you, sir.
Hello? So నేను వచ్చి అవేర్నెస్ ఇచ్చి వెళ్ళిపోవడం కాదు. మీలో ఎవరైతే బ్లడ్ ప్రెషర్ డాక్టర్ ఉందో మాది హెమటాలజీ క్లినిక్ కృష్ణమారెడ్డి పోలీస్ స్టేషన్ పక్కన దర్గా ఉంది. అర్థమైందా? sleep